There have been great advances in treatment of localized prostate cancer, and here to talk about how he is helping to fight prostate cancer with focal therapy is Dr. B of Prostate Cancer Institute of Arizona. How you doing, doctor?
Great, great.
Okay, let's first talk about what localized prostate cancer is.
Yeah, that is when men present with cancer just localized involving the prostate only with not being spread to other organs. And this is the earlier stages when screened and highly curable. Many treatment options that are available. Traditionally, the common treatment is to treat the entire prostate gland. However, that can lead to a lot of unwanted side effects, such as incontinence and impotence. And therefore, there is now emerging treatments to see if we can treat only the cancerous portion of the prostate, called focal therapy, and thereby minimize and spare these potential devastating side effects.
Got it. Okay, now let's talk focal therapy. You said something very important. That is pretty much pinpointing the area of the cancer and the localized cancer and taking care of it. So is that what kind of like focal therapy does?
Yeah, so there are many different ways to deliver focal therapy. I deliver focal brachytherapy, where I implant radioactive seeds only in the cancerous portion of the prostate. Now, there are a lot of advances now in imaging and genetics that have allowed us to identify just the cancerous portions in the prostate gland. And there's also advances now in the brachytherapy planning where I can incorporate these advanced imaging modalities where I'm able to precisely implant the radioactive seeds in just the cancerous portion, thereby sparing the normal prostate and therefore men having much less side effects. In my experience so far, these men undergoing focal brachytherapy have virtually no symptoms.
Wow, amazing. And we have to mention that what you've been doing has been around for a long time. We're just starting to see a new advance in it, but this has been something that you studied way back, when you started, and now you're really wanting to move more with this kind of treatment.
Yeah, the low-dose rate brachytherapy has been around for a long time, and now there's advances in that in low-dose rate brachytherapy now being applied to focal therapy. And so, yeah, I'm really excited about reviving this modality and advancing it as well.
Yeah, you're one of our Live Well partners, and one thing you really want is people to get checked, especially men. Everyone get checked for cancer, but men for prostate cancer, because we kind of like ignore our symptoms. We kind of like, blow it off, and we're kind of like embarrassed to talk about it, but that's where you come in. You're like, no, this is something you really need to start paying attention to.
Exactly. I mean, like I said in the beginning, when you find it localized in the early stages, the cure rates are over 95%. And so that's why it's really so important to have this awareness, and that also allows for these new advancing treatments. The focal therapy is really for the men with the earliest kind of stages, where there's a minimal amount of prostate cancer identified from their prostate biopsy. And these men are typically really motivated to preserve their sexual and urinary function, and accept the fact that, doing focal therapy, there could be a possibility of the cancer returning in the other areas of the untreated prostate. And that's why these men have to be monitored very closely with frequent checkups.
Yeah, and there it's so important there. Let's talk about the Prostate Cancer Institute of Arizona. You guys are located where, and how can people get a hold of you more?
Well, you guys have my website, phone number. We are located in Chandler, Arizona, but perform this procedure all over the city.
There it is. And of course, you're part of our Live Well program, which is so important. So, doctor, I appreciate you coming by and seeing us. So.
Thank you so much.
All right.